We all know that minerals are important, but why? Here's what you need to know about what's in your food, or your Flintstones chewables. Most minerals are considered essential and comprise a vast set of micronutrients. There are both macrominerals required in amounts of 100 mg per day or more, and microminerals required in amounts less than 15 mg per day. Why is an adequate mineral intake so important? Mineral deficiencies can create or exacerbate chronic health conditions. 5 macrominerals. Calcium deficiency. Long-term inadequate intake can result in low bone mineral density, rickets, osteomalacia and osteoporosis. Toxicity will cause nausea, vomiting, constipation, dry mouth, thirst, increased urination, kidney stones and soft tissue calcification. Sources: dairy, green leafy vegetables, legumes, tofu, molasses, sardines, okra, perch, trout, Chinese cabbage, rhubarb, sesame seeds. Phosphorus deficiency, very rare. Those at risk include premature infants, those who use antacids, alcoholics, uncontrolled diabetes mellitus and refeeding syndrome. Toxicity, very rare. May result in soft tissue calcification. Sources: legumes, nuts, seeds, whole grains, eggs, fish, buckwheat, seafood, corn, wild rice. Potassium deficiency, not a result of insufficient dietary intake. Caused by protein wasting conditions. Diuretics can also cause excessive loss of potassium in the urine. Low blood potassium can result in cardiac arrest. Toxicity occurs when the intake of potassium exceeds the kidney's capacity for elimination. Found with kidney failure and potassium-sparing diuretics. Oral doses greater than 18 grams can lead to toxicity. Symptoms include tingling of extremities and muscle weakness. High-dose potassium supplements may cause nausea, vomiting and diarrhea. Sources: sweet potato, tomato, green leafy vegetables, carrots, prunes, beans, molasses, squash, fish, bananas, peaches, apricots, melon, potatoes, dates, raisins, mushrooms. Magnesium deficiency, very rare due to abundance of magnesium in foods. Those with gastrointestinal disorders, kidney disorders, and alcoholism are at risk. Toxicity, none identified from foods. Excessive consumption of magnesium-containing supplements may result in diarrhea. Magnesium is a known laxative, impaired kidney function, low blood pressure, muscle weakness, and cardiac arrest. Sources: legumes, nuts, seeds, whole grains, fruits, avocado. Salt, sodium chloride deficiency, does not result from low dietary intake. Low blood sodium typically results from increased fluid retention. One may notice nausea, vomiting, headache, cramps, fatigue, and disorientation. Toxicity, excessive intake can lead to increased fluid volume, nausea, vomiting, diarrhea and abdominal cramps. High blood sodium usually results from excessive water loss. Sources: any processed foods, whole grains, legumes, nuts, seeds, vegetables. 9 microminerals. Iron. Consume iron-rich foods with vitamin C-rich foods to enhance absorption. Iron deficiency, anemia with small and pale red blood cells. In children it is associated with behavioral abnormalities. Toxicity, common cause of poisoning in children. May increase the risk of chronic disease. Excessive intake of supplemental iron is an emergency room situation. Cardiovascular disease, cancer, and neurodegenerative diseases are associated with iron excess. Sources: almonds, apricots, baked beans, dates, lima beans, kidney beans, raisins, brown rice, green leafy vegetables, broccoli, pumpkin seeds, tuna, flounder, chicken meat, pork. Zinc. Zinc deficiency results in decreased immunity and increases the susceptibility to infection. Supplementation of zinc has been shown to reduce the incidence of infection as well as cellular damage from increased oxidative stress. Zinc deficiency has also been implicated in diarrheal disease. Supplementation might be effective in the prophylaxis and treatment of acute diarrhea. Deficiency symptoms include growth retardation, lowered immune stature, skeletal abnormalities, delay in sexual maturation, poor wound healing, taste changes, night blindness and hair loss. Those at risk for deficiency include the elderly, alcoholics, those with malabsorption, vegans, and those with severe diarrhea. Toxicity symptoms that result are abdominal pain, diarrhea, nausea, and vomiting. Long-term consumption of excessive zinc can result in copper deficiency. Sources: mushrooms, spinach, sesame seeds, pumpkin seeds, green peas, baked beans, cashews, peas, whole grains, flounder, oats, oysters, chicken meat. Copper deficiency, relatively uncommon. Clinical sign is hypochromic anemia unresponsive to iron therapy. Neutropenia and leukopenia may also result. Hypopigmentation of skin and hair is also noticed. Those at risk for deficiency include premature infants, infants fed only cow's milk formula, those with malabsorption syndromes, excessive zinc consumption and antacid use. Toxicity, rare. Symptoms include abdominal pain, nausea, vomiting, and diarrhea. Long-term exposure to lower doses of copper can result in liver damage. Sources: mushrooms, green leafy vegetables, barley, soybeans, tempeh, sunflower seeds, navy beans, garbanzo beans, cashews, molasses, liver. Chromium deficiency, symptoms include impaired glucose tolerance and elevated circulating insulin. Toxicity, generally limited to industrial exposure. Long-term supplement use may increase DNA damage. Rare cases of kidney failure have also been documented. Sources: lettuce, onions, tomatoes, whole grains, potatoes, mushrooms, oats, prunes, nuts, brewer's yeast. Fluoride deficiency, increased risk of dental caries. Toxicity, children can develop mottled tooth enamel. Swallowing toothpaste with fluoride is typically the cause of this problem. Symptoms include nausea, abdominal pain, and vomiting. Sources: water, tea, fish. Iodine deficiency, impairs growth and neurological development. Deficiency can also result in the decreased production of thyroid hormones and hypertrophy of the thyroid. Toxicity, rare and occurs in doses of many grams. Symptoms include burning mouth, throat and stomach. Fever and diarrhea can also result. Sources: sea vegetables, iodized salt, eggs, strawberries, asparagus, green leafy vegetables. Selenium deficiency, can cause limited glutathione activity. More severe symptoms are juvenile cardiomyopathy and chondrodystrophy. Toxicity, multiple symptoms including dermatologic lesions, hair and nail brittleness, gastrointestinal disturbances, skin rash, fatigue, and nervous system abnormalities. Sources: Brazil nuts, mushrooms, barley, salmon, whole grains, walnuts, eggs. Manganese deficiency, not typically observed in humans. Toxicity, generally from industrial exposure. Sources: green leafy vegetables, berries, pineapple, lettuce, tempeh, oats, soybeans, spelt brown rice, garbanzo beans. Molybdenum deficiency, never been observed in healthy people. Toxicity, more likely than deficiency. Still very rare. Sources: legumes, whole grains. Mineral absorption. Our bodies and the foods we eat contain minerals, we actually absorb them in a charged state, i.e., ionic state. Minerals will be in either a positive or negative state and reside inside or outside our cells. Molecules found in food can alter our ability to absorb minerals. This includes things like phytates, found in grains, oxalate, found in foods like spinach and rhubarb, both of which inhibit mineral absorption, and acids. Even gastric acidity and stress can influence absorption. If you liked the video, don't forget to like and subscribe. Want more content? Watch videos in the description. So until next video.